Speak sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Beyond the FDA panel, medical experts reaffirm the safety and essential role of SSRIs for perinatal mental health. Break after the break. FDA's July 2025 expert panel on SSRIs and pregnancy. Break, medical leaders, professional societies, and perinatal mental health organizations voiced widespread concern about the panel's one-sided portrayal of antidepressant use in pregnancy. Experts across psychiatry, obstetrics, and maternal health emphasized that the event downplayed decades of evidence supporting the reproductive safety of SSRIs and failed to acknowledge that untreated maternal depression itself carries major risks. For both mother and baby. Over the last few weeks. Several articles from perinatal psychiatry experts were published in the Journal of Clinical Psychiatry. Why getting major depression right matters, and number 148, for mothers, babies, and all of us. And number 147, Jennifer Payne, MD. Prioritizing mental health to optimize perinatal, fetal, and neonatal outcomes. And number 147, K. Roussos-Ross, MD, Tiffany A. Simas, MD, mile per hour, Med, MHCM, M. Camille Hoffman, MD, MSc, Emily S. Miller, MD, mile per hour. PSI Response, FDA panel discussion regarding SSRIs in pregnancy. And number 147, Postpartum Support International. Consensus among experts and organizations. While the FDA expert panel raised concerns about the safety of SSRIs during pregnancy, there is strong consensus among medical experts regarding the importance of effectively treating mood and anxiety disorders in the perinatal period, supporting the vital and well-established role of SSRIs and other psychiatric medications as essential options for those who need them. Across statements from national medical organizations, perinatal advocacy groups, and experts in maternal mental health, there is consistent agreement on several key points. Untreated or undertreated perinatal depression is dangerous. Perinatal psychiatric illness is associated with significant morbidity and mortality, with recent studies indicating that suicide is a leading cause of pregnancy-related death in the United States. The consequences of untreated depression speak tend far beyond maternal suffering, and are linked to increased rates of preterm birth, low birth weight, impaired infant attachment, and poor neurodevelopmental outcomes for children. Both ACOG and the American Psychiatric Association underscore that effective treatment and number 148, including medication when indicated, and number 148, is not optional, but essential to safeguarding maternal and infant health and reducing preventable deaths. SSRIs and other antidepressants are evidence-based, life-saving treatments for many pregnant and postpartum individuals. Is ACOG President Stephen J. Fleischman, MD. Stated, SSRIs and number 156, are life-changing and life-saving, and number 157, for those who need them. Scientific evidence from multiple large-scale studies and registries supports their reproductive safety when evaluated in context. Public misinformation or exaggerated risk claims can cause harm. Organizations including Postpartum Support International, PSI the Maternal Mental Health Leadership Alliance, MVLA and the Policy Center for Maternal Mental Health warned that alarming or unsubstantiated statements about medication risks may discourage women from seeking care, thereby increasing the risk of untreated illness. Individualized, evidence-based decision-making is crucial. Professional societies, ACOG, APA, and SMFM, reaffirm that treatment choices during pregnancy should be made collaboratively between clinician and patient, using the best available evidence, and weighing risks associated with exposure to medication, as well as risks related to untreated psychiatric illness in the mother. Break core themes in the professional responses. Break scientific validity. Break experts such as Jennifer Payne, MD Break and Roussos-Ross, MD Break highlighted the extensive epidemiological and clinical data drawn from hundreds of thousands of pregnancies demonstrate that, after controlling for potential confounding factors, SSRIs are not associated with major increases in congenital malformations or neurodevelopmental disorders. Break clinical necessity. Break treatment is essential. Those with milder forms of illness may respond to non-pharmacologic interventions. However, for those with moderate to severe or recurrent depression, medication is often required to maintain stability and prevent relapse, especially given the elevated vulnerability to mood and anxiety disorders due less than speaking the perinatal period. Break ethical communication. Break several organizations urged the FDA to engage practicing clinicians and maternal mental health experts before convening future public panels, to ensure that guidance reflects prevailing scientific consensus and avoids stigmatizing treatment. Break shared conclusions. Break across obstetric, psychiatric, and maternal mental health communities, there is a clear consensus. Break both medication exposure and untreated mental illness carry risks. But the data show that for many women, treatment with SSRIs represents the safer and more effective option. Public health messaging must reflect balanced, evidence-based information. So that pregnant and postpartum individuals can make informed decisions in partnership with their healthcare providers. Maternal mental health is integral to perinatal and infant well-being. And undermining confidence in evidence-based care jeopardizes progress made in reducing stigma and improving outcomes for families. Break resources for patients and providers. Break American College of Obstetricians and Gynecologists. Break Society for Maternal Fetal Medicine. Break American Psychiatric Association. Break MGH Center for Women's Mental Health. Break Postpartum Support International. Break National Curriculum of Reproductive Psychiatry. Break Policy Center for Maternal Mental Health. Break Maternal Mental Health Leadership Alliance. Break. The following document summarizes information on the use of SSRIs in pregnancy, reviewing the risks associated with medication exposure, as well as the risks associated with untreated depression in the mother. This printable document can be used to supplement decision-making in clinical settings. Download plain language summary, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs. Less than /speak.